friends, it's Michelle Green with Morristown TV today. And every month, well, at least for the past few months, we have tried to come to you from the health department with Sherry Montgomery, the director of the health department, to give you some updates on what's happening. Well, I was able to actually pinpoint her this time because, again, as you can imagine, she is insanely busy. And we definitely want to talk about some really relevant issues that are on the absolute forefront of everybody's brain right now. So first off, let me say to you, Happy New Year, Sherry.
Well, thank you, Michelle, and Happy New Year to you as well.
Thank you. We're hoping and praying that it is going to be a new year, which is a good year. So let's go ahead and jump in and talk about what's happening right now today in the month of January here at the Hamlin County Health Department.
Okay, well, the newest thing starting out with us this year is that we are offering the COVID-19 vaccinations now. And that is something that we're all just trying to work through the process. It's brand new, but we are vaccinating now Monday, Wednesday, and Friday from the hours of 9 to 12, 1 to 3, and on Tuesday and Thursday afternoons from 1 to 3. We're doing this by appointment. We are following the state of Tennessee COVID vaccination plan for priorities. So we're currently vaccinating in phases 1A1, which include our first responders, our home health staff, our hospital staff, and then the long-term care facilities who are going to be vaccinated with a contractual arrangement with CVS and Walgreens. Also in this group are individuals who are 18 and older who have a chronic disease, a mental or developmental delay, and cannot live independently.
Okay. I do have a question for you as far as that. Are these folks that have to come to you with some kind of doctor's note that says, I have this issue, I fall in this category? Or are you just basically taking people's word for it when they come and say, I have an issue, I fall in this category, I need to get a shot? How are you dealing with that? Or has that even been an issue?
It hasn't really been an issue. For most of the categories, there's some kind of identification that they do qualify. But the general health conditions, we are not in that phase yet. It's just those who cannot live independently. Then we're also vaccinating in phase 1A2, which includes basically all kinds of healthcare providers. It includes dentists and pharmacists and their staff. It includes urgent care clinics and staff, outpatient laboratories. It also includes funeral home directors and staff. So that's a rather large category. And then with the beginning of January, we now also can vaccinate those individuals who are ages 75 and older. So we have been very, very busy with this population added, and we're so grateful that they can get their vaccinations now because they are very much at risk of mortality and morbidity with COVID. I want to stress that all of our vaccinations are by appointment because we have to be sure that we have vaccine availability. And we are currently offering the Pfizer vaccine, which is a 2-dose vaccination. In the early days, right before Christmas, we had the Moderna vaccine, and that is also a 2-dose. But from here on, it looks like it's Pfizer for us. So this is a Monday through Friday addition to our services here.
Oh, and again, those services are still just as important and still just as ongoing. I do have a question for you about the 2 doses. If somebody comes and gets a shot tomorrow, what's the waiting period before they get the second dose?
It's the 21 days with the Pfizer, and I believe it's 28 with Moderna. And when someone is vaccinated here, and all of this occurs outside, no one has to enter the building, then they're given a card with the date that their vaccination has to be done before the date on the card so that they're aware of that as well.
Well, and if you think back to me, I think of that, and it's very similar to even like probably when you and Tony and I were in school. We had to get our cards before we could start kindergarten that show that we'd had our certain vaccines. Right. So that basically is the same, correct?
Well, this is just a reminder for the second dose, really, and it's very important to have full efficacy for the illness, to get that second dose, to have full protection. And of course, we're still testing, doing COVID testing, but it's important to know that we've had to change that schedule because of adding the vaccinating. So now the testing schedule is on Monday, Wednesday, and Friday. We can offer by appointment something called an Everly Wells self-test. We give the kit to the individual, and they go to their car, do their own test, and bring it back to us at the window to send to the lab. But in order to do this, you have to be 18 or older, have a smartphone, and have your own email account in order to do the self-test.
Okay, well, as far as the self-test, is it a nasal swab or they just do their throat? How does that work?
It's a nasal swab. And then on Tuesday and Thursday mornings from 8 to 11, we're doing the on-site PCR testing like we were doing before. But now that is only on Tuesday and Thursday mornings with the vaccinating added as well.
Okay, but now that's not appointment for that, correct?
Yeah, that's just walk up still, right. And you're right, all the other things we did before COVID from the health department, those are still going on too. You still get your birth certificates, your death certificates, WIC services, other immunizations, family planning, STI checks. The list goes on and on and on. So all those things are still going on as well, outside for the most part, yeah.
Well, you know, I have to say, I know you guys, you and your staff, everybody here, you are just so covered up. You are so busy. But I will say, everybody that I've talked to that have either utilized the health department for other services or they've been here for a COVID test or whatever, they always talk about how everything runs so smoothly and you all are so professional and so I don't know if you ever hear that. So there, on behalf of you who have told me that, I'm sharing it with Sherry. So
Well,
kudos.
thank you, Michelle. Can I say one thing too? Sure. I know that people are very upset that they can't get COVID vaccination appointments when they want them. And please rest assured, we're going to be offering these vaccinations Monday through Friday for a long time. And the appointment availability is based on the vaccine availability. So as soon as we get the vaccine shipments in, we're opening appointments and we're getting it in arms. So please understand, we're getting people in as quickly as we can.
So ask people to please be patient, please be understanding. Again, this is like you said earlier, this is still brand new to everybody. So again, I commend you and everybody here for everything you're doing for our community. You are very much appreciated.
Thank
so,
you, Michelle.
and again, I know Sherry was throwing out all the times for appointments and such, and I have a feeling everybody's not going to remember that or have a pencil in their hand. Mm-hmm. So please call the health department. Go to the website. Will it be on the website as well?
I know that on the Hamlin County government website that the COVID testing, Mayor Britton has posted all of that. I'm not certain about the vaccination times currently because that will change and go to different phases as we move through the state plan.
Okay. But still, for somebody to set up an appointment, again, whether it's for a shot, whether it's for a WIC, anything, just please give them a call here at the health department.
223-586-6431 and press 0.
Press 0. Sherry, thank you so much. And again, like I said, and I mean it with all sincerity, thank you so much for what you do, not just here, but in Jefferson County as well. You are a very busy lady, so thank you. And friends, you know, we like to cut up and play and talk about silly things, but, you know, we want to bring you important information that you need to know, things happening right here in your community for your safety and your welfare. Thank you for staying tuned to Channel 7, and we will see you next time.